Personality disorder. So how the personality, human personality, we have studied about psychology, type A personality, type B personality, various different types of personality we have studied. How the personality is being formed, like a repeated behavior, how you behave, you what you conceive in your mind, conceptualize, and actions you are producing, the repeated actions and forming that will form your personality. So the personality disorder is different from the mental illnesses. It is also known as a character disorder. It's deeply ingrained the maladaptive pattern of behavior or continuing throughout the most of the adult life, or the less obviously seen in the old age. So this personality is really will be affecting the others also, but these people never think that they have the disorder or never think that they have the problem. In this personality disorder, they are making it like a cluster A personality, cluster B, and cluster C personality. Cluster A personality, paranoid personality disorder. The paranoid people always have a mistrust and suspicious people. They will think that, oh, anybody is talking and they are talking bad about me. They never trust anyone. Then the schizoid personality disorder, the limited range of emotions will be there. When interacting with others, there is no emotions they will be showing, because they also have these feelings of this one. Then schizotypical personality disorder. And then cluster B, there is called antisocial personality disorder. Antisocial, always they will break the laws, rules, regulations, violation. Then borderline personality disorder, they will have low self-esteem and mood swings always they will be having. Then histotonic personality disorder, this is an inappropriate behavior, mainly this inappropriate behavior to get the attention seeking from the others. If there is a exam tomorrow, or if there is something serious discussion is going on, something, they will act like they are fallen down like that. So everybody's attention will be on them. Then narcissistic personality disorder, this is perceived as the superiority or the grandiosity. They will think that they are very from the royal family, they are from the very rich family, but they will be suffering. They think that themselves very high. then avoidant personality disorder, this is negatively judge the other people, others, and avoid it. And then dependent personality people, just opposite, that they everything they will be dependent to be cared by someone. You want to go, the mother will tell you have to go first. No, you resign and come. I cannot study, I want someone to be with me. You both parents resign with me and come to me. One of my friend is telling, my daughter is telling, so we are sending her nearer to the college. So that's a overproductive child may develop this kind of personality. Obsessive compulsive personality disorder, if these people are personality, they are like over extreme perfection they want. If they immediately everything should be, things will be proper and very neat, very hygienic should be. So these kind of people are perfectionist. They will not be no flexibility, you must very strict in the perfection, they will be like that. So only this personality disorder, there are other disorders also will be there. Other disorders are called the paraphilic disorders. Paraphilic disorder is called the atypical sexual attractions. So typical sexual attractions, that means normally every man have a sexual attraction towards the opposite sex, right or not? Here this they have the sexual fantasies. Voyeuristic disorder, the voyeuristic disorder, without concern of anyone, they like to watch the naked people without their knowledge, or anyone having sex, they want to watch without their knowledge. And exhibitionist disorders, this person would like to expose his erected penis to someone else. So he will go nearer to the women's hostel or somewhere, and he will open his open his private part and show to the opposite sex people. And then froteuristic disorder is rubbing the private part always. Sexual marxism disorder, it's like a humiliating, like sex activity is like a hormone actually needing for the pleasure, but this person will be doing humiliation to make the sexual opposite partner to feel pain or produce pain, or putting a hard part articles or the cigarette making him to cry. And sexual sadism also same thing. They are very sadist people. They like harass the sexual. They will be very hardly will be doing and will be harassing them, beating them very bad, and their private part they will be bite many things will be, this one will be especially women will be suffering with this men, and torturing, sexual torture he will be giving. And the pedophilic fetishistic disorder, it's like the children, they want to have a sex with the children, those who are not attained the puberty, small children. And then transvestichoria, this is the dress like a opposite sex, they are very happy. Slowly they may become chance to become a transgender. The transvestichoria is the opposite sex dress they will be doing. Then other paraphilic disorders are the telephone scatologia and the necrophilia, that's they want to have sex with a dead body. And partialism, then some they partialism is some part they like female means they want to see only that particular part or the breast or something. Judophilia, they want to sex with some animals. Coprophilia is like feces and defecation, they like to see. Urophilia, urinate on something like that. And then autogynephilia is himself, they thinks autogynephilia means he thinks himself as a female. So like this kind of a sexual disorder are there. Another one is fascistic disorders. It is continuously act as he or he has physical or mental illness. This fascistic disorder is a two type of disorder. Either he will act or excuse me, fascistic disorder imposed on self. He is mentally, physically sick, but he is completely all right. He will act. Otherwise, he will tell others, another person. No, he is sick, sees the another one is sick like that. He will tell. To seek attention from the others, they are acting like this. So, main cause of the personality disorder also, like how we have seen the causes of mental illness, same like a genetical causes, biological factors, trauma, or the verbal assault, and some of the cultural factors all will be the reason. So totally we can see that mental illness are also classified as a broadly classified as psychosis and neurosis, mental illness. So psychosis, neurosis, we have covered anxiety disorder, OCD, mood disorder, bipolar disorders, all these things. Then also other thing is called the personality disorder. Also it is coming under the it's not a mental illness, but it's also coming under the psychiatric. They never think that they are having. Also, but not only personality disorder, other disorders are including the various kind of atypical sexual disorders. So, with the dead body, with the children, what and all we have seen. So, only this much classification is there? No. There is another thing is there. It is called the secondary mental behavioral syndrome associated with the disorder. Why it is called secondary? Primarily they don't have the mental illness, but the removal of breast or removal of the body part, some pathological condition or the disease is progressing, they will have some of the diseases. So they are international classification of diseases. In the psychiatric illness, they are also classified under the sections. So, secondary neurotic developmental syndrome, secondary psychotic syndrome, secondary mood syndrome, secondary anxiety disorder, secondary OCD, secondary dissociative disorder, secondary newly cognitive syndrome, secondary the personality changes, secondary the catatonia, secondary special secondary mental or behavioral syndrome, or many disorders they have classified as a secondary because after some pathological condition they are developing this disorder. So overall if you see, so the mental illnesses are how these questions may be coming. For example, they are telling you to write the OCD. You write it like you have to write one introduction about OCD. What is called OCD? Where it is coming under? It is like which classification? Psychosis or neurosis? So what is the causes of OCD? What is the types of OCD? Signs and symptoms of OCD? Then what is the treatment for OCD? Everything don't like only for without drugs you write it last, but you can write it about everything. CBT you can write, family therapy you can write, interpersonal psychotherapy you can write, or psychotherapy you can write. You cannot write immediately or schizophrenia anything, ECT that and all. The treatment aspect has to be medical treatment will be the last, because all the drugs have the side effects. Understand? For example, short notes on the mood disorders. So you can write what is mood disorders are coming under the classification of what you have to write. Okay, so like a psychosis or neurosis, so it is coming under nearly psychosis. So they are not aware of it. What are all the causes of mood disorder, as we discussed, like anybody's death or trauma or vitamin D deficiency? What are all the classification under that? What are all the mood disorders are? If especially particularly about only write about mania or depression separately, they are asking, you write the definition of mania. It is coming under what classification? What are all the signs and symptoms of mania? And then what are all the therapy, how you have to antidepressant or mood lithium or mood stabilizer, last you have to write it. Depression also. So this is the overall concept of mental illness. So mental illness major classification, psychosis, neurosis, but it is not stopped by the psychiatry. We have another personality disorder and sex related disorders and the other disorders. Okay, thank you.